Good evening and thanks for staying tuned. Welcome to our COVID-19 update. I'm Ladi Akere-Doluale. Here are the highlights at this hour. United Nations links COVID-19 pandemic to spike in sexual and gender-based violence in Nigeria, seeks political and legislative will to tackle the trend. Borno State budgets 18.3 billion naira for COVID-19 issues as it revises its 2020 state budget. And United Kingdom authorities say first COVID-19 case in the country was 1 week earlier than thought, just as Indian capital Delhi records more than 9,000 cases in 1 week. A town hall meeting by the United Nations Spotlight Initiative Against Gender Violence in partnership with Channels Television is held in Lagos and indeed around the country, with speakers drawn from national and international organizations tracing causative reasons for rape and other forms of violence. In the 3-hour debate, which held both virtually and in real terms from Channels Television's live studios in Abuja and Lagos, the United Nations resident coordinator in Nigeria, Mr. Edward Kalon, linked the spike in cases of gender-based violence and rape to the COVID-19 lockdown. The United Nations coordinator also says it has become increasingly important to involve society, starting from the family, to curb the issues of gender violence in the country.
What we learned during the COVID-19 pandemic era was a breathtaking reality. We witnessed a spike all over in violence against women as a result of the lockdown and other excessive hardships that families were encountering. And some of those hardships reflected themselves in what I call personally unnecessary violence, because partners were not able to engage each other and there were limited space to understand the overall situations that the family was going through. So you found out that because of those differences, we witnessed a new dynamics, and that was excessive violence against women. And to some extent, the children were also victims in that process.
Edward Kalon, United Nations resident coordinator in Nigeria. The National Examinations Council, NECO, has intensified monitoring of schools in Niger State, where students of junior secondary schools have resumed to participate in the basic education examination. The council says it will not hesitate to sanction schools that breach the safety measures put in place for COVID-19 as prescribed in the guidelines provided by the examination body. Emperor Simon brings us up to date.
Students of junior secondary schools have resumed in Niger State majorly for the basic education certificate examination, which started yesterday. And officials of the National Examination Council are not leaving anything to chances. The registrar of the council, Professor Godswill Obioma, has been going round to monitor the level of compliance with the laid-down regulations for protection against COVID-19 in schools. He says he's impressed with the level of compliance that he has seen.
As you recall, before we entered into the school, our temperatures were taken with infrared thermometers. We also were made to wash our hands in running water and sanitize them with hand sanitizers. So our interest was to make sure that the 2 meter apart from one candidate to the other is complied with, and that is what has happened here.
At the Federal Government College, Mina, we interacted with management of the school, and they say they have put in place all safety measures to protect the students and their teachers, including a sick bay where persons who show symptoms of COVID-19 could be rushed to before taken to the hospital.
For the children, presently, we don't allow them to be in crowd, and we take their temperature, they do their washing of hand, and use their hand sanitizer with their face masks all the time, and we don't allow them to be in clumsy area, being together all the time.
Niger State currently has a total of 237 confirmed positive cases of COVID-19, with 12 deaths so far recorded. From Niger State, Emperor Simon for COVID-19 updates.
Staying in north-central Nigeria, but this time in Kwara State, where frontline health workers managing the COVID-19 pandemic have been assured of due compensation after it is over. State Governor Abdurrahman Abdurrazak made this known during a visit to the health workers managing patients at the State Isolation Center at the Sobi Specialist Hospital in Ilori. The governor, who was at the center to commend the health workers for their sacrifices in saving lives, assures them that apart from special allowances which are presently being paid, the government will continue to appreciate them.
I think they've been the best COVID-19 team in Nigeria. They've done well. We're following what they're doing. Training, retraining, dedication. They volunteered even before the new government was going to give allowances to them. So they volunteered, and they've been doing the work until we came out with allowances for them. And after this is over, we'll recognize what they've done and appreciate what they've done.
And 18.3 billion naira, that's the amount the Borno State government has allocated to the COVID-19 response in its revised 2020 budget. And that's according to the State Finance Commissioner, Mr. Adamu Lawan, who was speaking during the breakdown of the budget in Maiduguri. The amount includes grants and support the state government expects from donors. Mr. Lawan says the 2020 budget was revised to reshape the priorities of government for effective and efficient implementation and for good governance in the face of the COVID-19 pandemic.
Reduction in non-essential overheads and capital expenditures proportionate to the amount of revenue reduction plus the additional COVID-19 responsive expenditures. 4, TAC allocation of expenditures to COVID-19 programs for crisis and recovery amounting to 18,342 million, representing 17% of the total amended budget expenditures. Grants and support for effective response to the pandemic in the revised budget is estimated at 8,910 million. 5, the budget deficit is fully financed from internal loans with no new domestic arrears.
Meanwhile, the Borno State Ministry of Health says that so far tested 7,000 people for COVID-19. The Health Commissioner, Dr. Sali Okwayarbura, says that more people are voluntarily presenting themselves for testing and that the state government is considering expanding its capacity for that. He adds that the number of positive cases is drastically reduced and that the ministry has now taken the testing campaign to localities outside of the state capital.
Implemented several strategies for testing. Now we have people voluntarily coming in to test, and then we're also going out in the communities to increase testing within the communities, particularly outside the Maiduguri Metropolitan Council. And we're almost done with the activation of the second test center, the second laboratory, so that we will ensure that more and more people are tested, because one of our limitations at the moment is the fact that the laboratory that is already testing in the UMTH is being overwhelmed by a number of samples and the staff. So we need really to take that pressure off from there. And then it's my hope that within this coming week, we should be able to get the other lab activated.
In the South-South, 373 total confirmed COVID-19 cases, 326 recoveries, and 21 deaths. That's the situation in Bayelsa State, where the government there has promised to continue to ensure that community spread of the disease is contained while balancing the issue of lives and livelihood. The state public health director of the ministry, Yerim Bulemi Stowe, who is also a member of the state COVID-19 task force, says the state government has great plans for the post-COVID-19 economic recovery of the state.
There's so much the state is planning to ensure we recover immediately, And again, part of what they are doing is to ensure that the workers, especially the civil servants, are continuously being empowered. Bayelsa State is also one of the only states that will continue to pay full salaries to healthcare workers, despite the fact that a lot of our neighboring states have started cutting on salaries. But the state governor said, no, my people, have to be empowered, and that is what is happening. And again, beyond that, there's so much the economic team, is putting together to ensure that post-COVID-19, we still have a very stable state and a stable economy going forward.
When he recovered from a bout of COVID-19 infection, the Foreign Affairs Minister, Mr. Jeffrey Onyema, suggested what he thought might be a way of ensuring widespread treatment for the virus. Speaking at the Presidential Task Force on COVID-19 briefing on Thursday, 13th of August 2020 in Abuja, the minister talked about introducing a strategy of treatment that would be fairly simple.
It is important to get tested early, but of course we don't have the capacity, we know that, to test everybody that wants to be tested. And I was actually even discussing earlier today with the Minister of Health that maybe in the cases where people cannot be tested soon enough, to recommend a cocktail of some medication, because sometimes, it's a respiratory disease. It starts off with the upper respiratory area, and what we don't want is for it to move down to the lower respiratory area, and it really helps to, to be on the medication early to stop that. So I think it's one of the things we really have to address in those cases where people don't have access to testing. But don't be, don't feel it's anything shameful to go and be tested or to have this disease or whatever. Just treat it like any other. It could be malaria. It could be flu, and just don't feel that somehow it's a stigma and you're carrying something that that would not be accepted and acceptable.
Let's take a look, deeper look, that is, at the Honorable Minister's suggestion. Joining me in the studio is pharmacist, President of the Pharmaceutical Society of Nigeria, Mr. Sam Ohabua. Thank you so much for coming in.
Good to see you again, laddie.
The minister is not a doctor, he's not a pharmacist, he's not in the medical profession, but there have been quite a number of people that have made comments since he made that suggestion almost 2 weeks ago now, that perhaps this, with a few tweaks, could work. What was your impression of that?
Well, I think the minister was just being honest in dealing with some situation that has become largely intractable, in view of the fact that there is no certified cure or even a reliable therapeutic medication. I thought he was just persuaded by impulse to say this, perhaps as a way of helping. In a way, because this COVID is an unusual situation, such things can be tolerated. I mean, like you see happening in the United States, where Donald Trump is promoting one cure after another. But the only thing is that in our climate, it could be injurious as well. Because in the United States, for example, no matter what Donald Trump says, you can't obtain hydroxychloroquine without a prescription. A doctor must write it. But here, anybody can get anything from anywhere, starting from Idumota Market, the area market in about to Central Market in Kano. You can just walk in there and ask for those drugs they asked for, and you'll get them. And that's the danger, because it will lead to perhaps an excessive self-medication, which can be injurious, because as we have repeatedly said, drugs are two-edged sword. They can heal, they can kill. And therefore, we must do our utmost to manage that kind of situation here. If it was in a climate where only doctors prescribe medicines, and it comes from authentic pharmacies that dispense, I would have had no problem with it, because the situation calls for some drastic and unusual methods.
In that case, let me ask you then, if it was tweaked to suggest that first you go for the test,
Yeah.
then you go to the doctor.
Yes.
And then they prescribe this.
And then you go to the pharmacy.
And then you go to the pharmacy, you pick it up,
Yes.
and then you may then be able
Yeah.
to have this administered on you
Wonderful.
if it is more widely known.
Yeah. I mean, that's the tweaking I think you are thinking. It was done this way, that would have been wonderful. Because it's evidence. You know, a lot of people have been given anecdotal evidence.
Right.
Clinical trials are going on, but a sick person is going to wait for the results of the clinical trial before they get treated. So doctors have been innovative by using some experiential, experimental tests. That's what goes on in an epidemic like this. If you wait for completion of clinical trials, many people have died. You know, and when you have the scientific evidence, which is the right thing, the scientific evidence that determines that it works. But if one or two or three doctors have tried this and it worked, why don't you try to the fourth or fifth person? And if a responsible person like the Minister of Foreign Affairs has used it and he's a member of the COVID task force,
course, right.
and he finds it useful, I would have preferred he follow that protocol you just suggested. You know, let's call the medical profession, call pharmacists and say, look, this thing is working, why don't you people consider it while we are still doing all these formal trials, so that we might save one or two patients? Because the question is, what is the alternative? If people are not given medications, they either die or they have a longer stay in hospital.
Which costs money.
Costs money. They have other morbidities, which you may not know immediately. The longer the disease stays in you, the more it affects your respiratory organs and other parts of your body. And I mean, like your colleague in CNN said, after several weeks of illness and getting well, he's still not feeling...
that's Richard Quest.
Richard Quest, he's still not feeling well. So that's the only part, because making this public announcement is license. I mean, if the Minister of Health, if the Minister of Foreign Affairs, then what is there? Why do you go to a doctor? Why do you ask for anything? The day you have a small headache or small cough, don't walk to area market or in Dubota or somewhere, ask them to mix the medicine for you. You know the Nigerian language, mix it for me. They enter any better medicine shop, license, unlicensed. You know, this is why our country, we have to be much more careful. And that's why our country needs to do more to control drug availability. Drugs are available in this country in a very scandalous manner.
Yeah, because hydroxychloroquine, I'm sorry to interrupt, but hydroxychloroquine, which you mentioned earlier on, and which you said, look, is unavailable in the US without any kind of prescription, regardless of who is talking about it.
Yes.
Here, the minute it was announced and some people started talking about it here,
it became a scarce commodity
because people wanted it.
The food that had it.
The price went through the roof.
Yeah.
So it brings, I guess it brings to mind the general issue of treatments.
Sure.
Because people are anxious to be treated. Some are even anxious to prevent getting to the stage where they need treatment, which is which leads them to all of this.
Yes.
Do you really think, from everything you know, I mean, from the pharmaceutical industry, do you really think that beyond what we are hearing, we are any closer to getting something either by way of a vaccine or by way of a therapeutic intervention anytime soon?
Are you talking about Nigeria on the global?
Well, I mean, first global, but then, of course, Nigeria, because this is where we are.
You know, well, for the global, yes, there is sufficient evidence that a lot of work is going on. Responsible nations have incentivized pharmaceutical companies. I mean, some of them have put orders. Put orders to
for hundreds of millions of
they've
doses.
given them money upfront to do the work. Okay, so they are using the money to find out. They will not sleep. They can hire everybody, hire the best scientists, best pharmaceutical scientists, best medical scientists, medical scientists, and say, work night and day, cover you. There's money to be made. You know, so that's what they raise. That will bring the thing, because it is the incentive for the private sector all over the world. Let them taste money. It's like tasting blood. And they go
become
out.
sharks.
I'm telling you, they will sleep. They can provide beds and living homes like you guys. I'm sure you sleep here sometimes. Provide living homes for people in the office. So that's what will happen. That gives me, because if government said this was government business, as we sometimes need to do in Nigeria here or in Africa, we think these things are government, and government can't go far. They motivate the private sector, and the private sector takes it. So that gives me hope that a vaccine is close by. Of course, not not before November 3, hopefully, but it is close by. As for the therapeutics, you know, the truth of the matter is that in the first place, most viral illnesses really do not have therapeutic cure. Truly, I mean, as a matter of first principle, everybody who is a medical scientist would tell you viral infections are self-limiting. You know, so what naturally is always required is how you can boost your immunity. First, to resist it.
Right.
And then if you can get vaccine that can help you develop antibodies that can help you now fight. The body is equipped to fight disease, viral, bacterial, but some can be overwhelming, especially in compromised immune situations, and then you calm down. So a therapeutic cure takes a long time to be established. I mean, you have HIV, AIDS. Still, it has not brought cure. What HIV, AIDS, antiviral medications is to prolong life, to keep the viral load at a level that the person can run his normal life. There are very few who have become AIDS-free. They become AIDS because they've been taking the therapeutic. They now say they are AIDS-free. There are very few, if any. So the hope is on vaccine. If people can get a vaccine, then people can live with it. They can take vaccinations and they move on. Therapeutic cure, many things can be therapeutic because in antiviral therapy, many things can be therapeutic.
It's at that point that we're going to have to leave
including lemon juice.
President of the Pharmaceutical Society of Nigeria, thank you so much
Thank
for
you,
being with us. Thank you for
inviting me. Thank you again.
We'll take a break. When we come back, we'll talk to a public health physician about this and bring you the latest in the statistics of where Nigeria is in its battle with COVID-19. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. There is some good news for Nigeria and indeed the African continent, as the Africa Regional Certification Commission has declared Nigeria and the rest of Africa polio-free. The World Health Organization says this marks the eradication of second virus from the face of the continent since smallpox 40 years ago. ARCC spokesperson Rose Leak says the region has successfully met the certification criteria for wild polio eradication, with no cases of the wild polio virus reported in the region for 4 years. The decision, according to her, comes after an exhaustive, decades-long process of documentation and analysis of polio surveillance, immunization, and lab capacity of the region's 47 member states, which included conducting field verification visits to each country. The last case of wild polio virus in the region was detected in 2016 in Nigeria. Since 1996, polio eradication efforts have prevented up to 1.8 million children from crippling lifelong paralysis and saved approximately 180,000 lives. While the federal government says it is taking more serious precautions as the global fight against COVID-19 continues, the Nigeria Center for Disease Control, the NCDC's, last night announced more cases of COVID-19, putting the total number now at 52,548. The 321 new cases were confirmed in 23 states and the Federal Capital Territory. The FCT has remained in the top 5 states with a total confirmed caseload put at 5,028. As of today, it has the highest number of cases on admission at 3,534, followed by Lagos. Sadly, the nation's capital has recorded 46 deaths as well. While the nationwide death toll from COVID-19 is put at 1,004, the country reached the undesirable record of 1,000 fatalities on August the 23rd, which, according to the chairman of the Presidential Task Force on COVID-19, is a vivid reminder of the dangers that the country still faces. So far, 12,287 persons with COVID-19 are receiving treatment across the country, and the total recoveries now stand at close to 40,000, precisely 39,257. Senior lecturer at the College of Medicine in the University of Lagos, consultant public health physician, Dr. Alera Roberts joins us via Skype from the Ikoyi area of Lagos. Good evening, Dr. Roberts. Welcome to the program.
Thank you very much for having me. Good evening.
I'm curious to know what you make of the Foreign Affairs Minister's thinking, suggestion, treatment protocol for COVID-19. I mean, maybe with one or two tweaks, because I see your head going down.
What do you want me to say? I think the president of the Pharmaceutical Society of Nigeria said it brilliantly earlier on. I mean, you cannot make those kind of statements. You simply cannot. I mean, the fact that the president of the freest country in the world is making such uneducated statements doesn't mean that we should follow suit. It's so difficult because we already have a huge problem with people using medication in an inappropriate manner, and it's causing a lot of problems. And as the president of the PSN said, because we have a largely unregulated drug industry, I mean, we're not that far from the tramadol, the codeine, tobacco. You cannot make those kind of statements. The truth of the matter is there's absolutely no treatment yet for COVID-19. All we have are the prevention and, like he said, some of the anecdotal protocols that doctors can use for patients.
But the minister does have a point, though, doesn't he? Because on this program, you and I and a host of other medical personnel have talked about facilities and personnel getting overwhelmed by the number of cases, especially if we ramp up our testing. Because the other part of what the minister pointed out was that if we do more testing, there will be definitely more cases. And if there are more cases, there needs to be some kind of strategy that enables us to treat those cases without overwhelming the facilities as well as the personnel.
Well, the truth of the matter is, Ladi, with or without the testing, there are cases. We know that. We're in community transmission and there are cases. We are just so blessed that in our part of the world, the large majority of the people who are getting infected are simply not showing symptoms. So whether we like it or not, people are doing things or not doing things, and they're simply not showing the symptoms. So we haven't had that massive overwhelming of the health system like they saw in, say, northern Italy, or they are seeing now in the US. But that is simply not a reason why we should now put out a mass treatment of something that we know is not going to work. As the president of the PSN said, doctors are trying strategies. You try. I did exactly that. I read something somewhere. I'm not going to say it because I don't want to be quoted. It worked, and by and large, many of the patients that I've managed, I've used that protocol for, and a lot of I know it's being used in some of the isolation centers. But until we have clinical trials where there are control arms, we cannot categorically come out and say this or that drug regimen is a cure or a treatment for COVID. We can't do that. So nobody should make that mistake. We can continue to do things and, compassionately, you have a patient, he's not doing very well, you throw everything you can legally at it. But that doesn't translate into a mass treatment regimen that can be put out for the public to use. No, not without the proper clinical trials.
Since we're talking about treatments, and this is related to testing, there is also the controversy over whether or not we are using the PCR testing method, or where there's the other testing method, which at some point was being discussed, because that enables you to do far more tests quickly and probably cheaper. Now we are in the middle, because some of the test results that people who were tested outside Nigeria brought back were those type of tests. And then when they were retested here using the PCR method, the results were different. So where exactly do we stand on this now? Are we to continue with the PCR test method, even if it means we are not able to test as many people as we should?
Well, the PCR testing is the gold standard, and we do it, we target it, it picks up the actual virus in your body. So the problem is that if you've had the infection and you're on the mend, you will still have some viral fragments, which of course may still test positive, but that doesn't mean that you're infectious. That's number one. So when we're talking about, say, the rapid diagnostic test, where there are a lot of false positives and there are some false negatives, then the issue is that you now take it, you see, a test in and of itself is not the whole picture. You have to take it within the context of the clinical picture that the person is presenting with. So if the person is ill, yes, we would use the PCR test. But if it is for these sorts of situations where you want to say, get on a flight or whatever, and you want to do the rapid diagnostic test, and the person is perfectly all right, then, you know, it's still all right. I mean, we have to do something. We have to move on with it. You know, if the person starts having symptoms, then of course we're going to use the PCR test to come up with a clinical diagnosis and use that to determine what the treatment should be. So we're still betwixt and between, Ladi. And the truth of the matter is, this is it. This is just the way it is. At the end of the day, we still must stop the prevention. Because if you don't need to go out, don't go out. If you must go out, maintain 6 feet away, 2 meters away from everybody, and wear a face mask. Wash your hands more frequently. Use an alcohol-based sanitizer if you can't wash your hands. Because at the end of the day, the prevention is what we have.
You did talk about us being quite lucky at the beginning of this conversation, the fact that all the predictions were that the death toll, the infection rates were going to be much higher in this part of the world than in any other part. So the question then is, not why was that the case, but going forward now, people talk about spikes. We haven't seen any spikes.
No, we haven't. We haven't seen any spikes. And we don't know why. The research still has to be done. I wish the universities would get back to work so that we could get the researchers to work on some of these questions. Because what we are seeing now, frankly, is that the effect of the virus is on the economy and not on the human population. And that effect on the economy is actually quite devastating. And that is a bigger problem. So until we get that under control, we can't go on like this. We have to get that under control. So we don't know why we're not seeing it. And if we did know why, it would enable us to better open the economy and be able to shield those who are probably more, at risk of severe disease. So let's get the universities working. Let's get the researchers back to work.
Indeed, Dr. Roberts, thank you so much for your time this evening. Thanks for coming along, and do continue to stay safe out there.
You too. Thank you for having me.
Outside our show, scientists in the United Kingdom believe the earliest person to have contracted COVID-19 within the UK was a 75-year-old woman from Nottinghamshire. She tested positive on February the 21st. She is also believed to have been the first person in the United Kingdom to have died after contracting the virus. Before now, it was thought the transmission of COVID-19 with the UK for the first time occurred on February the 28th. Here's more on those findings.
News about the first case emerged slowly, as scientists are believed to have been analysing samples in retrospect as they investigated the origins of the pandemic in the UK. Nearly 2,000 routine samples taken from patients at a Nottingham teaching hospital between January and March were tested. Analysts say the findings are not surprising, given the limited testing early on in the pandemic, which meant that only a small number of people were checked for the virus. The work also reveals that early coronavirus cases in the UK would have been identified if testing criteria had at the time been less strict. Meanwhile, Prime Minister Boris Johnson says he is really pleased by the work teachers have done to get ready to reopen schools from next week, a test of his government after it failed to return all children to schools early this year. Mr. Johnson's government has come under fire for how it has tackled education during the present crisis, saying it was crucial for all children to return to school and that he would look at medical evidence to see whether he should change the government's advice on wearing face coverings.
I think the crucial thing is that all pupils get back to school next week and in the succeeding days in the staggered way that we want. And I'm really pleased by the work that teachers, schools, parents, pupils have done to get ready, and the steps they've taken to ensure that there is social distancing and to ensure that schools are safe.
Education Secretary Gavin Williamson on Monday echoed a warning from medical advisors who said students faced bigger risk from missing out on their education than from catching COVID-19.
At every stage, we followed the advice of the chief medical officers, whether that is for, and we saw just at the weekend, the chief medical officers for England, Wales, Scotland and Northern Ireland saying it is now safe for youngsters to return back to school. And actually there's more harm done to those youngsters by them not being in school. That's why it's the right time for all children to come back.
On the other hand, an experimental COVID-19 vaccine being developed at the University of Oxford and AstraZeneca could be put before regulators this year if scientists are able to gather enough data. The Oxford vaccine showed early promise in the first human trial when it produced an immune response, underlining its position as one of the leading candidates in the race to produce a vaccine against a disease that has crippled the global economy. Meanwhile, COVID-19 infections and fatalities are still on the rise worldwide, with the confirmed case tally and the total death toll of the virus standing at over 23.3 million and over 806 deaths. The US and Brazil remain the top two in both confirmed cases and deaths.
Our correspondent in London, Juliana Olayinkana, now gives us more from her neck of the woods. Juliana, nice to have you with us. She joins us via Skype. What's this I was hearing just before I came in about the UK government doing a U-turn on students and face masks? What's that about?
Good evening, Laddie. Yes, there has been a U-turn from the British government. I've got to say, another U-turn in a long list of U-turns. And this one is going to be pretty controversial because it does involve school children. School children in England will be back in schools. Well, fingers crossed, we hope they will be next week. And there had been an ongoing discussion, particularly between the teachers' unions who are not happy. They don't feel as if they've been given enough guidance, enough advice or advice from the government about how they can make it safe. The First Minister of Scotland, Nicola Sturgeon, did suggest yesterday that she believes children in Scotland should be wearing face masks where they are unable to social distance. This did cause a little bit of a row and a stir. Then we heard from the Wales First Minister saying that he would be considering it. And then just couple of hours ago, breaking news here in England is that when schools do resume next week, any pupil above 11, so if you're going into year 7 in secondary school, you will have to wear a face mask. Now, there is going to be a lot of backlash from this, and I would say a little bit of controversy. There are so many parents, millions of parents, I've got to say, that still feel very uncomfortable about sending their kids to school. But we do know that, you know, wearing a face mask, I wear them outside, I'm sure you've worn one too, they can be quite uncomfortable. So it's whether or not the government are going to be able to convince parents that they should be sending their children to school wearing a face mask is going to be a massive hurdle that the Conservative government are going to have to get themselves over.
Speaking about the Conservative government, what's the position of the Prime Minister on this?
Well, you know, we heard a little bit from him, didn't we, in that report that we just saw. And I've got to say, earlier today, when he did speak, I believe he was at a plant somewhere in Devon, he did kind of go back slightly. What the government have always said is that when the science is taking them into the right direction, they will be happy to change their mind. But the issue is, what we've seen over the past couple of months is that rather than the four nations, England, Northern Ireland, Scotland and Wales, working together, they have slowly been drifting apart. And I've got to tell you, Nicola Sturgeon, the First Minister of Scotland, who, by the way, is backing a Scottish independence referendum, she appears to be leading the four nations. A lot of the U-turns and the decisions that have been made by Boris Johnson have followed her lead, particularly with this mask fiasco. But the government, the Education Ministry have confirmed that they will be asking pupils next week to wear a face mask. So, of course, it does have the backing from the Prime Minister, and we'll be expecting to hear a full statement from him tomorrow, I should suspect.
AstraZeneca has just started an antibody drug trial, is it?
AstraZeneca have started an antibody drug trial. This didn't make too much headways in the UK today, as it should have, and that's because it's actually been funded by the US government. Apparently, this new drug, it's not a vaccine, and it's really important to emphasize that. It will be able to help people who are suffering from coronavirus symptoms, and it will also help you in your recovery if you have had coronavirus. The American administration, including Fauci, who's one of the leading pandemic experts, they have heralded this as being a major breakthrough. I think it cost in the region of about $30 million, and it is being developed here in British laboratories. They are still very much in the early stages. It's in phase 1, but if it does get the green light, it will go on to phase 2. Also really important to mention that, of course, AstraZeneca are currently in the process of developing a new vaccine with Oxford scientists, Oxford University scientists, and we're waiting for more developments on that later in the week.
When I spoke to you last week, Tuesday, people were just starting to be aware that if they didn't get back to the United Kingdom and they were coming from particular countries, they were going to endure a 2-week quarantine period before they were let back into the country. How did that work out?
Well, last week, Tuesday, I think I was actually enjoying my staycation, laddie. But if we're talking about the week before that, look, you know, I've got to tell you, there's been so much upheaval when it comes to these travel corridors and if you can or if you cannot travel. One of the issues we have here in the UK is that the test, track and trace system doesn't seem to be working to 100% of how it should be. And so we're not really sure whether or not people that have been coming back from Spain and France have actually been self-isolating. But it's really interesting to say, because we have been talking a lot, and scientists have been talking a lot about this second wave of infections, this new surge that we're seeing across the global north, particularly in Europe and Britain. But even though we are seeing an increase in infections, we are not seeing an increase in deaths. And that's really, really telling. And hopefully for a lot of the scaremongers out there, it should keep them well assured that, you know, the fact that Britain are testing as much as they can, the hospitals are not at the capacity that they are. And also the amount of people that are being infected, I believe the age is much lower. It is making people to believe that perhaps the winter, the cold, long winter that we're all familiar with in England, may not be as cold with COVID-19 as some may have suggested it would be.
Something else that will be making people quite cold would be the effects of this, the recession, some 20 percentage points in contraction the last quarter in the UK. And that is happening almost at the same time as the scheme that government put in place to pay workers who were not otherwise going to have been employed was tapering down. What kind of impact is that having on the economy?
Well, we know that the UK economy is in its worst recession on record. We haven't seen these numbers in over 300 years. We've already seen, I believe, at the last count, about 787,000 people had lost their jobs during the pandemic. And that number is on the rise. Every single day you're hearing about job cuts. Even earlier today, Co-op, which is a pretty small bank, they announced that they're cutting 350 jobs and other jobs in the head office. And those numbers may seem small, but when you add them up, it's absolutely a humongous figure. Now, the Bank of England have actually said that they suspect that 1 million more people will lose their jobs. And you're right, this has got a lot to do with the tapering off of the furlough scheme. Furlough, a word that nobody had used before 2020, has become a major buzzword here in Britain. About 9 million people are on the furlough scheme. And basically what it means is that the government have been paying people's wages for the past 4 or 5 months. It has been reduced from 80% to 60%. At the end of October, it will come to an end. And a lot of employers are saying that they simply cannot keep these people on. We're not expecting mass redundancy of 9 million people, but there are some suggestions The 1 million plus jobs that the Bank of England are saying will go is just a conservative number, but it could be as much as 3 or 4 million. And you are feeling the pinch. You're not seeing the traffic numbers that you should be seeing in some of the most popular places. Eat Out to Help Out, that was a scheme put forward by the Chancellor of the Exchequer, Rishi Sunak, this month to try and boost the hospitality industry by giving discounts of up to £10 per person. But the numbers just aren't there, laddie. And unfortunately for Britain, it's a service-based industry, a different economy to what we're seeing in France and Italy and Germany. And again, I've got to use another buzzword for the year. We've got Brexit en route. And so a lot of people that potentially could have kept people on before aren't likely to take that risk because they know they've got another big chopper coming at the end of the year.
All right, then, Juliana, thank you so much for that. Do continue to stay safe out there.
Thank you.
The number of COVID-19 cases in the Indian capital, Delhi, has been on the rise, seeing more than 9,000 cases in the week from August 18 to the 24th. There's been little change in testing numbers since the start of August, which should have accounted for the increase. Delhi has one of the highest testing rates in India and has done nearly 76,000 tests per million people, much higher than the national average of just under 27,000 per million. Here's our global update.
A lockdown has been declared in the Gaza Strip after the first coronavirus cases were discovered outside its quarantine centers. An outbreak in impoverished Gaza has been greatly feared because of its weak healthcare system. Overnight, police moved quickly to clear people from the streets and impose a 48-hour curfew. Schools, mosques, businesses and the beach have all been closed. The director of the Oxford Vaccine Group says an experimental COVID-19 vaccine being developed by the University of Oxford and AstraZeneca could be put before regulators this year if scientists are able to gather enough data. The Oxford vaccine showed early promise in the first human trial when it produced an immune response, underlining its position as one of the leading candidates in the race to produce a vaccine against the disease that has crippled the global economy. The Australian state at the centre of the country's coronavirus second wave on Tuesday reported 148 new COVID-19 cases, more than the previous day, but well down from peak levels and 8 deaths. Victorian Premier Daniel Andrews said that testing numbers were up from the previous day because the testing was conducted over the weekend. And South Korea is closing all schools and kindergartens in the Greater Seoul area following a rise in cases there. The Ministry of Education says remote learning will have to continue until the 11th of September. All students will now learn from home, with the exception of high school students set to take the university entrance exam in December. Meanwhile, as holiday in popular destination sites such as Bali and Hawaii are not possible this year for South Koreans, some of them are bringing vacation spots into their homes, transforming their apartments into where they would have been had the outbreak not happened. The Indonesian island of Bali has said it will not open to foreign tourists again this year, going back on its plan to reopen next month.
That's our COVID-19 update for tonight. As always, you can take a closer look at the stories and some of the global numbers as well as the national numbers in real time by visiting our website, channelstv.com. There are updates and a better understanding of all that you need to do to stay safe during this period. Of course, there are also other stories from different genres, politics, business, and sports. Thank you very much for watching. I'm Ladi Akere Doloale. Do continue to stay safe and have a good evening.